All right, more of your comments in just a little bit. Right now, we're going over to Ariane.
All right, well, if you're a mom, you know that childbirth is miraculous, but it can also do a number on your body. Joining us now is Dr. Tad Grenga, director of the Chesapeake Center for Cosmetic and Plastic Surgery, with some options for the mommy makeover. Dr. Grenga, welcome to the Hampton Road Show.
Good morning. Thank you.
So, moms out there, they've had a child and they're interested in going down this path. How would they know if they're a good candidate for this type of surgery?
Well, that's a very good question, and when the children come and the figure goes, that's the time to start thinking about it. Plus, this time of year, spring's coming, summer's coming, summer outfits, you know, bathing suits and short season's going to be coming. So, what we'll do in a consultation when we discuss the mommy makeover is to custom create a plan, and I'll use 2 or more of the procedures that I most commonly might perform. It could be a tummy tuck, liposuction of the hips or thighs, arms, even the neck, breast lift, maybe breast enhancement as well. And when we put that plan together, it's to help keep a woman looking her best and to restore a figure that might have been altered by pregnancy, breastfeeding included. And when that happens, we generally can restore it oftentimes to a more trim figure even before. So when a woman wants to see her figure rendered in high definition, it's time to start thinking about the mommy makeover.
Now, what if they've had surgery before? Can they go ahead and get this procedure done?
Oftentimes we'll see women have cesarean sections. That scar does not generally get in my way to help create the trimmer figure, especially with the tummy. Some operations might even give us a better hint as to how a patient recovered and use that as a predictor and how one might do as well in their recovery.
Well, I know we have some before and after photos that we want to show our viewers, and you can just explain what we're looking at here.
Well, on the left-hand side of the screen, Mariana, you'll see that we have individuals who've had their children. Generally speaking, we want to make certain that that phase of life has finished, and so then go on to address either the slack areas of the tummy. There's generally some loose skin, maybe some stretch damage as well. Oftentimes I find that the muscles have been separated by the actual childbearing itself, maybe even the factors involved with the delivery. So on the right-hand side, we'll see what's been created afterwards. We want to see that the breasts are uplifted, creating a more youthful shape. We want to see a trimmer contour around the waist, as well as the front of the tummy, a flatter surface, tighter muscles. Doing that helps to enable a person to conduct their exercises more efficiently, especially when it comes to sit-ups and other exertional activities they might like to pursue. When we see here on the left that there's excess amount of fatty tissue that just it stays, it remains there even after some very vigorous exercise and even ardent dietary attempts to get rid of it. And these are the places where we're going to be able to help the most, because they just don't go away. They're very resistant to even some very measures to help keep that figure trim. And so when it does not work for a particular individual, that's where our mommy makeover can be of help to create the more youthful figure, sometimes even an athletic figure, and to restore, sometimes to enhance a woman's natural figure after the childbirth effects.
And depending on some of the procedures, what is the recovery time like?
Well, the recovery time will vary from person to person. I think it depends on how fit and how athletically inclined that individual is to begin with. We'll like to generally see that after about 4 weeks, sometimes up to 6 weeks, we can release a person to exertional exercises and conditioning exercises, but we like a person to be working towards that in the meanwhile. It's not just a period of time to take time off, but rather to be working towards their ultimate goals, physically fit figure and a youthful, shapely figure.
Like you said, with summer and spring coming around, want to get back in those swimsuits. All right, so definitely if you want to talk to Dr. Grenga, you can schedule a consultation. The information is Chesapeake Center for Cosmetic and Plastic Surgery. That phone number is 673-5900, drgrenga.com. We'll have all that information on our website, thehamptonroadshow.com. Dr. Grenga, thanks so much.
Thank you, Ariane.
All right, there is a reason one of the 3 little pigs decided to build his house out of brick.